Well, as we are continuing in the new year, I am wondering how many of you are setting some goals around health this year. But as we all know, that health in midlife is a little different than it used to be. And so today we are actually talking about the new rules for midlife health. I am so excited about our guest today because she really is going to help us understand what are these new rules of midlife health. Her name is Dr. Szcepankski. And welcome, Dr. Szcepankski. We are so glad you're here.
Thank you, Krista. Thank you for having me. I'm so glad to be here.
So, we're going to call her Dr. Devan from here forward. And Dr. Devan is a board certified family medicine physician and a global leader in genomic and nutritional medicine. She is the founder of Reformative Medicine, and she integrates cutting edge genomic science with personalized healthcare strategies, bridging that gap between research and practical clinical application. And that's what we need. So we're excited to hear about that today. But what I love about her, we actually heard about Dr. Devan from a very dear friend of ours, Annie Pajic. And she is someone who is committed to education. She speaks a lot. She's an innovator in her field. And through her work at New Well Medicine, she empowers patients and medical professionals with science backed, gene based solutions to enhance longevity, which we're all trying to, look at these days, wellness and disease prevention. So, Dr. Devan, tell us first of all, what lights you up about this field of medicine?
You a loaded question. Um, so I think that, and I'll try to be as short and sweet as possible, but when I trained as a medical doctor and when I got out into practice, I often found myself struggling to answer the question with my patients of kind of why this happened, why they felt this way, how they got here. And instead was more taught to kind of check a box of symptoms and then that qualified me to qualify them to prescribe a medication. Right. And so very quickly in my early career, that got kind of unfulfilling. I mean, I still remember the first day I walked into medical school and I was super excited to be a doctor and to really learn how to help people in a very individual way. And I just really felt like I wasn't necessarily doing that. And so I also, I think, totally a God thing, I took the place in my first job, which was new back then, by the way. Nobody took jobs as doctors back when I started the new age of that. And so the first job I had was taking the place of a doctor who actually had left to go do what at that time called integrative medicine. And I respected her and I loved her. And she went to do that. And so she took some of her patients with her. And then some of her patients who didn't go either didn't go because of maybe resources and finances, or they needed still prescription medicines like things for blood pressure, diabetes, but they were already on the trajectory of, an expanded way, if you will, of doing what I had just learned. And so I started listening and I'm like, oh, this is really neat. She put you on this vitamin and it made you feel better. I want to know more about that. Right. And so I quickly found myself kind of in a little bit of a tug of war, I guess you could say, of, well, this side of things and kind of understanding what naturally could help my patients in terms of vitamins, diet, nutrition, lifestyle was very attractive, especially with patients who wanted to learn about that and implement that in their day to day. And that be a part of their care, if you will. But then I also really love the fact that I could do the blood pressure medicine for them and kind of help them get off of it if we could, and treat the diabetes. And so I didn't want to give up one or the other. And generationally ahead of me, that's what I had seen. It was kind of like you had to choose because those two, that's allopathic medicine and naturopath, call what you will, holistic, all the things, we're kind of at odds together of each other. And that was hard because I'm as a family medicine general practice doctor, really wanting to kind of pull from as many tools as I can to help the patient in front of me. And so what discovering personalized genomics did for me was really pull all of those modalities together in science. And then I was able to have a conversation with a patient about their own personal science and then decide based on that what to do in what order with their priorities as the priority. right? And so that's, I guess, my fire of genomics is because it's science, but it's the most personalized way that we can learn about our patient and how their body is built, their operating system, if you will, and then go from there. And I just think that opens up a conversation that we didn't have the ability to have before, but I didn't learn it in med school, that's for sure. So I get really excited about that.
Can you explain just briefly what genomics is for those of us who are like, oh, that's a word I'm not familiar with?
Right. So genomics and genetics and your DNA, right? You could kind of lump it all together. Genomics is more of understanding kind of the way the body interacts with the world. But when we talk about genomics or genetics, at least within New Well medicine and what we teach in reformative medicine is in nutrigenomics, really kind of nutritional genetics. So what are certain pathways we can look at in your body based on your DNA that gives us insight into what your body does genetically really well, and then where it might struggle in terms of diet, lifestyle, cholesterol, all those kinds of different things. And so we often would say, oh, if someone has diabetes, now they need a diabetic diet. But this says, who cares what your label is? That's not the first thing we're looking at. We're looking at how at a core is your body made, and then using that to direct and guide what we say to do next. And we actually just, Alex, to be completely truthful, my kind of jam is genomics. But really what we teach is that we understand our patients. We look at our patients in what we call a triangle of health. And that's really, so instead of coming and seeing us and getting your wellness labs, if you will, for the year, everyone who walks through the door gets what we call a triangle. And that is your DNA, so your genomics. It is a full comprehensive blood work. That's your function. We test the stuff you've probably had, but then your full hormone panel, you're looking at inflammation markers, looking at your immune system. Nothing crazy, but just more comprehensive than the 4 things on the wellness panel, right? So that's your metabolics, your labs, your blood work. It's how your body is functioning and communicating right now. And then the other part is your gut. So we look at a gut map. So, and if one of my partners was here, who's a pediatrician, you would see a really fun collegial argument on what's more important, your DNA or your gut. But anyway, the DNA is my jam, right? So that is our triangle. So if we have your DNA, that's your structure, that's your always, it's how God made you. Can't change it, but we want to work with it and not against it, right? Then you have your blood work, which is your metabolic, your labs, your function right now. And then we know how your gut is, and we can optimize that. And that's the connection between the two. Now we have a very different view of who you are, the patient in front of us, how your body's made, how it's functioning right now, how your gut is working to even do the things that we tell you to do. Than if we just said, oh, you're here for your annual wellness. Let's check these 4 things and tell you you're great. And then you leave. And for any woman in midlife, they're like, what the heck? Why do I feel so bad? So it's just really changing that perspective, not from all of allopathic medicine is wrong or bad or totally missed the boat. But we have the ability with modern technology, and it's very easy to get and do, which is, to me, it's super exciting time to be a physician, to really expand our knowledge and progress that science of how we do the art of medicine. Right? That's the bottom line. So it's really the triangle probably gets me super excited. But if you made me pick, Krista, I would say the DNA.
I love it. No, it's really true. It's really true. I've said that my whole life. Like, why doesn't my body work like everyone else's? And I know I'm not alone in that. I know a lot of women feel that way. And I know a lot of women who maybe's bodies have always worked. It's not new for me, but for a lot of women in midlife, they're like, well, actually, my body isn't working anymore. And so can you just tell us a little bit about what is going on during midlife that is creating a storm, so to speak?
Okay, well, you do know I turn 43 next week. I was like the day where you rescheduled this, and I was like, oh, isn't that funny? So what are we considering midlife? Tell me that.
Well, I would say anywhere from like 38 to 60.
Okay. Well, let's start here. Hormones, right? Like that's the easy thing to start. So I'll tell you my little spiel on that. So as women, girls, it is normal to start menarche or menstruating your period, right? 9 to about 18, 19 you can start your period, right? And maybe the outliers, you might start doing some lower, but it's kind of considered normal, if you will, because you're like, my body never worked normal. And I'm like, what's normal, right? So anyway, that's good. It's a good thing to say because a common thing we tell ourselves, but I would challenge it in that, well, what is normal, right? And what's your normal? So that's where the DNA comes in. So if it is normal to start your cycle as a girl, transition to a woman from 9 to 19, then why have we historically only said you're allowed to start talking about menopause or perimenopause or whatever when you're 50 and you don't have a period anymore? Like, that's cuckoo, right? I mean, I just told you that it starts, so it doesn't finish all at the same time at all. And back up, if you're 35 and you are pregnant and you go to the OBGYN, you actually get a diagnosis and a label as a geriatric pregnancy at 35. And so that's not even midlife for you based on 38, right? So,
Right.
so I think,
Yeah.
so geriatric pregnancy at 35 and you qualify, right? You all of a sudden qualify for all this extra testing because we know that your eggs are older and maybe your hormones and stuff are not the same as if you were 25, right? So how come we know that and we do it and we have implemented rules around how we tell physicians to do that and think about it. But yet when someone's 35 and a woman, we don't start talking about hormone changes and what's going on with the cycle. And it's not even on the list of things that you're checking off on your wellness. So that's kind of the minute you start asking questions about what is a recommendation and how does it apply to me and why is it there? And then you kind of back into, well, wait, I'm really curious about that. How does that apply to what we know now? You can easily see that, oh, well, wait, it totally makes sense to talk about hormones whenever. Really, right? You could be 9 and you could be 59 and we should still talk about it. And furthermore, it's one of the most important things of your body. It's hormones. We assume I'm talking about sex hormones, but when I say it, I am, but I'm also talking about your adrenals, your stress hormone, your thyroid, and this amazing endocrine system that God gave women that is so super complicated. And, it's communication pathways within our body and it's trying to protect us. And so I think the biggest thing that's not discussed, and I'm certainly never learned it in med school, is how much that interplay can really, if it's synergistic and it's working for you, it can do a ton of things that are super amazing. But at the same time, in this day and age, with just our lifestyles and everything we ask of ourselves and all those things, it can get really messed up really quick. I thought it was funny the video you're like, you're going to talk about the rules, the new rules. I'm like, well, the new rule is there's no rules, right? There's no rules because it's really understanding your body, your scenario, and then kind of building a roadmap to work with your body and not against it. And certainly don't do, another quote I really love is the wrong right thing. So intentionally working so hard at doing something that's actually your best friend's thing, but it's not your thing. And you're like infamous for that. So that's what I love about the DNA. And I love when the first time I started using a very snippet of the test we have now, I had a girl who I knew and loved and she was amazing. And I can still picture it like this yesterday. She sat in front of me, this little clinic I had, and she's a 2-year-old and she had worked so hard to have these babies. She's probably about 38. She's a 2-year-old on one hand. She has a baby in the carrier on the other. And she looked horrible. I mean, she was just like white and exhausted. And she's like, listen, I've done the same diet as my friend who just had a baby too. And she's lost 7 pounds and I've gained 8. And I'm going to Orange Theory 5 days a week. And I'm eating 800 calories a day and nothing's happening. And I was like, well, I have this genomic test. We could do it and see if that helps. I just started. And it was incredible. I mean, based on her DNA, she needed high calorie. She actually needed to work out more. Imagine that. I would have never told her to work out more. And I found a way. I'm like, actually, your body, you can eat whatever you want. But Orange Theory was great. The other part wasn't. And then next thing you know, she came back 2 months later and she was just feeling great. She had lost almost, all her baby weight. I mean, so for me, if I can give someone a personalized data to answer some of the questions they have, and then we can use that to make decisions, then maybe that's the rule. The new rule is it's your rule based on your own information.
what are some of the other things you look at when you're looking at genetics? I think women may be listening and saying, what about my genetics would impact my health in a unique way?
Okay. So now where I started with this is different than where I am now, because now we know more. And so it gets exciting. So we know more and more. But at a basic level, we have panels that we do that look at, and some of them are more medical than others. But for example, so our health panel is really looking at lipid metabolism. So cholesterol, like genetically, do you or do you not have an issue with cholesterol, right? ApoE is in there, which has gotten a lot of attention about, they want to call it the dementia gene. I do not believe in that. However, it's these things that kind of just additively add up, or this is a +1 and this is a -1, and those kinds of things. Liver detoxification, inflammation, methylation, which is how you absorb and use B vitamins, very important for hormones. Let me see. I don't want to get too, it tells you if you should have dairy genetically, should have things like gluten or not, how you should exercise. That's more of our active, what kind of recovery you need. Do you or do you not need collagen based on your DNA? There's a skin one, which is, you can kind of customize genetically what you need in a skincare routine, kind of as a foundational always. There is one called DNA hormone, and it actually looks at, do you make hormones well genetically throughout life? Do you then transport and bind them throughout the body well? And then do you detoxify and metabolize them through the liver well? So what I see often, as an example, is that women come in and they're either over or under treated because all someone is looking at is a lab, maybe, and they're not understanding that once they choose to give said HRT to that patient or a sub or whatever, they're not understanding how their body is built to receive that, and then how their body is built to use that. So the DNA greatly helps us understand even how to do HRT or versions thereof, if that makes sense. Yeah. So there actually is a panel for DNA hormone. One more thing that I think is one of my favorite panels, because I have a neuropsych degree, is there's a mind panel. So we know that, for example, estrogen in a woman's mind signals serotonin. Testosterone signals dopamine. Progesterone signals things like GABA. So I can look at someone's DNA of their mind and know, would they actually genetically have hindered serotonin pathways, for example? Okay, well, then I really need to look at estrogen in this patient to make sure cognitively we set them up for success. So what I think is super fascinating to become more and more aware of and understand is how actually these hormones definitely affect weight loss and, all the things that we talk about in midlife for women, but actually have such an amazing, incredible, powerful way to support your brain. And what we've done in the past a lot of times is we've used pharmaceutical or we've manufactured the thing for the brain that actually the hormones just stop doing as well. How many women, when they go into midlife and get put on anxiety or depression medicines or versions thereof, and actually it's just that the hormones were decreasing. It's not really that anything else was going on. And so that gets exciting. When you can get hormones right, you can understand with the DNA what things could possibly help this patient on a very personal level. And then you start stopping meds or just explaining how they're made. And sometimes that in of itself is super therapeutic. It's like the patient who, I'm on Lexapro because I have anxiety and I've been on it for 20 years, Dr. Devan. But I don't know why I take it, but every time I stop taking it, I don't feel good. And when my periods are around, I'm really crazy. And so I think I should just take it, but I have anxiety about the fact I take it, not that I have anxiety about taking the anxiety. And they're in a loop. You can do the DNA and kind of look at everything and you're like, oh, well, genetically, your serotonin pathways are completely hindered. This is why. And look, in that situation, you might say, take the Lexapro. If it helps, what a blessing. It's not a way to say all medicine is bad. It's a way to know why you're doing what you're doing based on your own personal science. And it can evolve as you evolve.
Yeah, I'm thinking about like women who are like, all right, in the new year, I want to get my health in order. I want to understand myself better. I don't want to work harder. I want to work smarter. So what do you tell them?
So I think it's almost, now look, I'm from the South. And so I don't know how much of this is cultural. I would say, I think it's less cultural than I used to believe, but it was always kind of Southern Belle kind of thing and do more with less, right? work out twice as hard, eat twice as less, or whatever, I mean, I see it all the time. And I think over time, we've really done a disservice to ourselves because it's not true. Or I'm 45. And so I'm just gonna be like this. And I would say absolutely not. There's no reason why you should feel or have to be any way just because of your age, at least. Right. And so what I often see are people are putting 3 times as much in to get one, a negative out. And it's because A, they think that's partially what they just have to do. And B, it's because they don't have their body set up to receive what they're even doing in the correct way. If you are metabolically not optimized to get out of what you're putting in, then that can be a really frustrating place to be. Mm-hmm. Right. And, or if you're just, again, doing the right thing. Well, I'm doing keto and I'm gaining weight. My friend did it and she lost 10 pounds and feels great. Well, maybe that's not the right thing for you right now, even. Right. So I think doing a better exploration on figuring out what is that next right thing would be my biggest advice. Mm-hmm. And probably not necessarily. Now, look, accountability is awesome. And it's fun to have friends who are doing that can work against us really easily.
Yeah. I mean, I'm thinking about so many women who are just hitting their heads against the wall and just frustrated. And so I think that gets to that idea that why does it work for this person and it doesn't work for me? I think that's something I hear all the time. Mm-hmm. What role does weight training and exercise play?
I think so. And everything you asked me, I'm going to say, well, it depends on how your body's made, but more than we ever thought. I do. And as well, I love all the latest and greatest on all of the digital media and everything about weight training, osteoporosis, right? Preventing that. And that's a new thing for me, I can say personally, but weight training is huge, but there are parts of your DNA that we look at that would tell you if you need more relative to the next person, weight training to get out of what you're putting in. And some women do. I mean, but it's good because I'm like, look, you're probably even not going to even like doing this because you're going to feel like you're not getting anywhere. But you actually need to work twice as hard because it's super important at this stage of life. And it's just how your DNA is made. And then they're empowered with that knowledge to make that decision and do it for the right reason. But I think that, yes, I mean, if as we are sitting here, we have increased muscle mass, then sitting here, we have a higher metabolic rate than if we didn't. Mm-hmm. Right? So like we're burning calories just sitting here with more muscle. So I do think we transitioned from a period of, and his history kind of does that skinny is better to muscle is maybe the most important thing at some phase. And I think that's very real. And just remaining strong and mobile and your ability to move as you age is probably one of the most important things that we have often overlooked, and especially in a very sedentary world.
Mm-hmm. Our life has changed as people over time. And so how many of the things that you're dealing with on a daily basis have to do with modern life? Like you would think maybe they 100 years ago weren't having to look at this because our diet was more whole foods.
So when I first went into practice and I went to a nutritional medicine training and I came back, and one thing that I had learned was about saliva testing for hormones, because I didn't learn really about hormones in med school. And the idea was that a saliva test, i.e. bring this test home on day 19 of your cycle on or around, you spit in this tube. And so you're getting, instead of a blood, a salivary sample of your hormones, estrogen, progesterone, testosterone, and DHEA, at the same time as your adrenals. So it gave you a cortisol throughout the day. Your cortisol should peak and come down. Okay. And so back then it was very expensive to order hormones through blood work. So I found myself doing it a good bit with a, 30-something-year-old woman. And it was so interesting because I would get the results back and I would do a couple little things nutritionally, maybe a supplement. And all of a sudden it was like I was the clinic for the spit test and everybody's coming. And like, I'm actually just helping women that much with a spit test. Like, this is weird. And so in hindsight, I would tell you, it wasn't necessarily that I was looking at hormones. It was how I was looking at them. And then in what context? Meaning, At the same time I was looking at sex hormones, I was looking at stress hormones by definition of what the test did, right? So therefore, I started having conversations with people about how their stress hormone was interacting with their sex hormones and vice versa. And I would argue that maybe it was or it wasn't the fact that it was a salivary tissue sample. We still do it. Love them. But maybe more that it was opening a door to have a conversation about, hey, I could tell you your estrogen's in the floor right now, and that doesn't make sense. But your cortisol's through the roof. You're so stressed out. So we need to talk about the stress before we address your estrogen. And at the end of the day, God doesn't want you to get pregnant when you're stressed out. So it's actually your body's doing what it's supposed to do. It's just in the wrong environment, right? And so that led to this whole idea that our bodies as human beings, and I would argue, I'm sure you have a bunch of men that listen to this too, so I might, but I think women are like super, super built to like get the cortisol going if you need it. You know what I mean? I mean, I go with baby and stuff. Like, you're just built for it. And it is incredible. It's like superwoman power, but then it can work against you real quick. And it starts messing up all kinds of stuff. I mean, we're like complicated, right? So we are made for predator coming, cortisol, autonomic nervous system, automatic, right? Cortisol goes up, fight or flight. You fight or you flight, and everything resolves within about 20 minutes max. I mean, we're made for that. We were built for it. Like you're like, oh my gosh, I never thought I could do that. It's not humanly possible. So 100 years ago, that was the scenario, maybe longer, but you know what I'm saying? A dinosaur coming, fight or flight, run away, and then you're like, done. Endorphins resolves completely. The predator, the stress is gone. And everything about that in you as a human being is actually good. That's what we're built for. So fast forward, problem is there's no dinosaur coming. Your body doesn't really know any different. And it doesn't resolve in 20 minutes, right? So instead, we have these subacute stressors all the time. And what your body does at first is it says, okay, I'm just going to give you more cortisol all the time because I'm not even turning on and turning off. I'm like constantly on. So let me just like set my baseline a little bit higher. And that starts to mess up with stuff. In the meantime, you feel awesome. But over time, and oftentimes when life settles down, which actually can take 5 to 7 years, believe it or not. Like you can do some pretty amazing things.
Oh, wow.
Yes.
Wow.
Then your body, it's your autonomic, right? Like you don't really have to control it, right? It says, oh, good. Oh, everything's good. Things are better. Oh, you're done with me. Okay, I'm done with you. And it drops to the floor. And then you start seeing all this stuff go on. You're like, why is my body acting like this all of a sudden? This doesn't make sense. Well, I should have felt like this 3 years ago is because of that. But it's showing up now. I definitely wasn't taught that, but it's a very important, over the years, it's been a super insightful way to have a conversation with a patient and explain how they got here that then can help to explain how to get it back right.
Well, yeah. So tell us, I mean, how do we regulate our cortisol so that it's it functions correctly?
Right. When we look at endocrine, when I say your endocrine system, really what I'm talking about, or hormones, is adrenal, cortisol, stress, fight or flight, thyroid, which I think is often overlooked and not brought into the picture soon enough, and then your sex hormones. And so all of those are talking. So at any moment in time, I think it's important to understand where those are and how they are either helping or hurting each other. With regard to cortisol, I think that the things that, and again, I would still tell you that you get insight from your DNA on even how you're built for cortisol, if you will. But to kind of say maybe what people can think about, I mean, that's why you have all this vagus nerve stuff. Look at sleep. I mean, I have an Oura ring on, recovery, more is not better all the time. And so, and it's awesome. I mean, there's a ton of talk about that. I think it's so real, like slow down. And I think that's hard. So my husband and I are just now in this stage, which I get it, because at that midlife thing, you also have the older parents who might, like, it's things that start happening, and then you got the kids and they're all, so there's always going to be that season of life that is evolving. I think so. Taking time to take time for yourself, and make sure that you are just aware of what's going on and even honest with yourself of what your body is doing well and is not. And even little ways of making that a priority, I think is super important.
Okay. Well, Dr. Devan, this has been a great part 1. We are going to continue with part 2 next week and hear more about these new rules, which we're learning are our personal rules for our bodies in midlife. So we'll see you next week.
Sounds great. Thank you.